Hi, it's Leslie Schmidt. I washed my hands before I got Baloo, my patient, out. I'm going to be performing a physical exam on him today. Baloo is an 8-month-old neutered male. He's a rescue dog. He's one of our clinic animals. We don't have any previous history around him. He came into us, he was probably around 4 months or so when he came in here. We don't have any idea if he had any trauma, but he does, however, have a little scar and some hair that's never grown back on his front leg. So it is possible that he may have some kind of an injury there. Probably more than likely did. It feels like a scar. He is 36 pounds today. I weighed him before he came in. So I'm just going to go ahead and start looking at him all over. I'll start with his handsome face. I'm going to look at his eyes with my ophthalmoscope. I am looking to make sure that his pupils react adequately to light and I don't see any tumors or anything or red sclera in the eyes. And they're beautiful. They're nice and brown. He's being a good boy, so now I'm going to look at his teeth, which are lovely. He has very white teeth. I'm also going to open up and see if I see any little tumors or abnormalities in his gums, which I wouldn't. He's very young. Now we're going to look at his ears with my otoscope. I'm going to check each ear carefully. And his ears are very clean. One ear, he's being a very good boy. It's okay, boy. I know. Oh, he didn't like that one. That one's okay. I'm going to put that back. Alright, let's see. Alright, I'm going to start listening to him. But I'm also going to go ahead and palpate from, I like to go ahead and start from the front and move all the way back. I'm going to palpate his lymph nodes up here. His mandibular, they're very small. There's nothing enlarged there. I'm going to go ahead and palpate the prescapular, the axillary, which I don't feel them. They're both fine on that side, nothing enlarged. I'm going to palpate for his inguinal. I don't feel anything. And the popliteal back here. I do not feel anything. They feel normal. He's being a very good boy, so we're just going to continue with our exam. He has a very fine coat. Don't see any flaking. Don't see any evidence of any scabbing, except, we got that little scar there. He's all uniform in color. He looks very good. He looks very healthy. He's got a very, very nice sheen to his coat. His nails all look normal. They're all nice and short. I'm going to check his feet. One at a time. All his pads look good. His deep claws look good. He's being a good boy. Alright, they all look very good. He's being a good fella. Okay, so I'm going to go ahead and start auscultating him. I'm going to listen to his heart and lungs and get a respiratory rate and heart rate. Alright, what I could hear by myself and listening, it sounds very good. It's nice and slow, like a working breed would be. His heart rate's probably around 80. And his respiratory rate is pant right now because he's panting. We're going to try to we'll kind of hold his mouth shut so I can watch him breathing. He's taking some little rapid, shallow breaths. We'll get a heart respiratory rate. Just hard to do by yourself. So once we stopped his panting, his respiratory rate is 30. So we've got a heart rate of 80 and a respiratory rate of 30. Just going to write that down. Okay. I'm going to check his hydration status too. I forgot to mention that. One way we can check is by pressing on the gums. I'm also checking his refill time. That's normal, but his gums are dry. They're nice and normally pink, but they're dry. Okay. Alright, buddy. I'm going to listen to his lungs again too, let him pant so I can hear them well. I'm going to listen on all the quadrants. They sound nice and clear. No crackling, no wheezing. And the further down I go, the louder it gets. I'm going to go ahead and do that on the other side too. listen a little bit further on his heart to make sure I don't hear anything. I'm going to listen on both sides. I'm going to listen for the mitral, the atrial, and the pulmonic valves on the left. And I'm going to listen for the tricuspid on the right. Sounds okay. Alright, so we're almost done with his exam. Alright, so we're going to go ahead and start palpating him. I'm going to start by palpating his abdomen for any masses or anything, and make sure he's nice and comfortable. And he seems to be fairly relaxed with that. Alright, I don't feel anything under there. Like I said, he is not intact anymore. He has been neutered. I'll check him out back here. His bottom is nice and clean. He looks very good. I'm going to check his skin underneath. It also looks very good. His penis looks fine. I don't see anything as far as on the outside. It looks abnormal. So we're going to start doing a musculoskeletal palpation on in just a second. We already did the lymphatic system, and his urinary system is fine. His bladder is small. I can't find it. I'd have to really aggressively palpate to find it. His penis looks fine. It's nice and clean. And as far as a neural exam on him, he is very bright and alert. He hasn't shown me any signs of any kind of a neurologic issue. I haven't seen any ataxia or any knuckling. He's walking normally. He's responding well to stimuli, so he has a normal neural exam. So we're just going to start palpating some of his joints. So we're start palpating his shoulder joint here. He said he doesn't know why I'm doing that. But it is not painful or anything. I just kind of caught him off guard. I'm going to do this front one. Just doing a little gentle range of motion on all of his joints. He's nice and relaxed. He just wonders what I'm doing. Good buddy, sorry about that. Good boy. I'm going to start doing the hips. That's a sensitive area for some dogs. It's a little difficult to do by yourself when you start trying. I think he just doesn't like that. That's a good boy. Okay, that's it. Okay, fella, that's a good boy. That's a good boy. All right, I'm just going to go back over my systems to make sure that we did everything. We did check his ears and his eyes. I checked his coat, listened to his heart and lungs. I did talked about his neural status. I palpated some of his joints, and we did palpate his stomach to make sure we didn't feel anything in there. We established that he's a neutered male, and that his urinary system is fine, and I did palpate his lymph nodes earlier. If I had to score him, I would say that he is a 5 on the 1 to 9 scale and a 3 on the 1 to 5. He looks very good. He's very healthy. And I'm just going to sign off on my notes and I finish my exam, and I'll be turning that in, and that concludes my exam of my dog Balloon. Thank you.